Welcome everyone to this Vulval Pain Society social media live. Today's topic is pain prevention and transmission. Does the gut microbiome hold the key? I'm Sheren Gaulbert, Vulval Pain Society Trustee, therapist and pain science educator. Please say hi in the comments if you are watching live. And absolutely, you can comment too if you are watching the replay. I'll be keeping an eye on the comments in the comments box on Facebook and on YouTube. So in case you're wondering why I seem to be looking off in a number of different places, that's all I'm doing. So do please say hi so I know that the tech is working. Catherine from the VPS is also in the background on Facebook. Hi Louise, thanks for joining us. Again, do say hi if you're there and watching along live. You can pop your questions in as we go through today, and thank you, Marion. Oh, hi, Marion, and Sarah, you've joined us too. So I can see there's 15 of you watching, so we're just going to dive in. So vulval pain, we know that it can overlap with a number of other functional disorders, such as irritable bowel syndromes, and there are other comorbidities, including other types of persisting pain. So the information today will focus on chronic or persisting pain or pain in general, and believe me, it will be relevant. The Vulval Pain Society team are all abuzz with excitement about this one. Seriously, they are in the background getting very, very jolly, because today's guest is the renowned microbiome expert, Siobhain O Mahony, Senior Lecturer, Principal Investigator and Director of BSc Neuroscience, University College Cork. Welcome, Siobhain.
Thank you, Sheren. Absolutely my pleasure to be here. Thank you so much for the invitation. I'm super excited.
Yay, brilliant. So today you're going to be sharing a little bit about what your research has uncovered and the importance of gut bacteria in preventing chronic or persisting pain. And you told me just in the chat beforehand that you've also got into women's health as well. So this is brilliant. Great timing. Before we get into that, tell us a little bit about yourself, your background, and how you got into this exciting field.
So I'm a neuroscientist by trade. So I did my undergraduate degree in neuroscience, and then I finished my master's in Galway and travelled for a little bit. So when I came back to Cork to do my PhD, I started with Professor Dinan. So we were the first in Cork in Ireland to set up this lab based on the concept of the microbiome interacting with your nervous system. So it was a few years ago at this stage, it was 2004 when I started my PhD. So it was a little bit like voodoo then, talking to people about your microbiome and bacteria within your bowel actually being able to interact with your brain and affect your well-being and anything that your nervous system actually controls. But now I think it's fantastic that it's so well known and appreciated how important your microbiome is within your bowel. So we progressed from there. So we started off on a small preclinical study looking at the impact of early life stress. And I established this animal model to look at early life stress, particularly associated with a cold relationship with the mom. And we basically established this model and investigated the impact of stressors in the postnatal period on the developing microbiome gut-brain axis. And we discovered basically that a stress during a particular important developmental period where stress should be maintained at a lower level, and this is called the stress hyperresponsive period. This exists both in rodents, which was our first study, but it also exists in humans as well. So it's quite translational, and we know that a lot of disorders have their origins in early life stress. So we really wanted to investigate what stress in this postnatal period is doing to this signaling axis, the microbiome gut-brain axis, which is a signaling pathway that really allows communication between your bacteria or microorganisms within your gut and your central nervous system and your body as a whole. So we progressed from there, and we've continued on with that type of research, and we've done a number of intervention studies trying to ameliorate the impact of early life stress. But I moved on from there then. I still carry out that type of research with interventions for stress in postnatal period, but I've moved kind of backwards a little bit into pregnancy as well, and in the preconception period, particularly looking at the impact of stress on the microbiome, on the maternal microbiome and gut health, and the impact on the developing baby. And I talk about some of the results from some of my research with regard to my studies for pain, looking at gender differences with regard to microbiome, and also pain post-surgery as well. But our field has grown enormously. There was only a few of us at the start, so it has grown enormously, which is great. And my mentors, John Cryan and Ted Dinan, have spread the word throughout the world, and now they've let me fly my wings, or spread my wings, and now I'm the one sending the message that we need to mind our microbiome gut-brain axis for overall health, but also very importantly for pain management as well.
Yeah, absolutely. And I remember seeing John Cryan a number of years ago at a lecture, and absolutely fascinating.
He's brilliant.
And I hadn't realized up until then that connection between pain and the gut microbiome. So should we actually, before we do that, because we were talking about APC Microbiome Ireland that you're part of. Do you want to tell people what that's about, and actually how exciting that is?
Yes, absolutely. I'm absolutely so lucky to be part of this centre. So within Ireland, there are 7 centres of excellence, and APC Microbiome Ireland in Cork is one of those. So we reapply for our funding every 5 years. So it's quite a large centre of at least 300 individuals at the moment, made up of clinicians, so gastroenterologists, psychiatrists, endocrinologists, but also a lot of research scientists as well. So microbiology, biochemistry, neuroscientists like myself, and pharmacologists. And then, of course, we're supported by our PhD students and our postdocs who are actually in the lab. They're back in the lab now, which is absolutely super. But this centre really it's the fifth largest centre in the world with regard to microbiome research. So what we do basically as a collective set of individuals within a centre is we all investigate the impact of the microbiome on the body or in the body with regard to health and disease. So I mainly focus on bacteria myself. Within the centre, people focus on viruses, phages, and nematodes, and all different types of microbiome in the different niches in order to investigate what has changed with regard to your microbiome, with regard to health or with regard to disease, and then how we can optimize or balance the microbiome in these different niches in order to reduce the impact of disease. So it's a fantastic place to work, and we have people from all over the world as well. So it's not just different science backgrounds or different clinical backgrounds, it's also different ethnic and cultural backgrounds as well, which of course makes it a fantastic and very diverse place to work. So I'm very lucky.
Brilliant. Yeah, sounds great. So let's get to the real basics here. When you talk about the microbiome, are we talking gut bacteria, or is it a bit more complex than that?
It is more complex. So the gut microbiome itself is also complex, but it extends well beyond the gut. Why I suppose there's a huge focus on the gut with regards to marketing and products that everybody will be exposed to with advertising is because you take an oral supplement or you take food, and this impacts directly on your gut microbiome. So I think this is why people are more familiar with the gut microbiome itself. But we spoke about the phrase holobionts a moment ago. So we as humans now can be viewed as holobionts, which is basically an ecological system where microorganisms exist with their host. So we are the host. And I think people know that we have microorganisms in several places of our body, but we have them actually virtually on every niche. We have them on our skin, the oral microbiome, the nasal microbiome. We have respiratory, and of course, then we have gastrointestinal. We also have reproductive tract and genital tract microbiome as well, which of course is extremely important. So maintaining the balance or the optimal levels of this microbiome in the different niches is extremely important. And if there's imbalance in one of the niches, we do know about it, because we need our microbiome in order to do extremely essential functions. They help with our metabolism, they help produce vitamins. So this is particularly with regard to the gut microbiome. They're associated with bone modeling and also fat absorption. Lots of different really basic functions our gut microbiome produces. And then with regards to other niches, for example, they help balance and help prevent pathogens. For example, skin microbiome is extremely important with regard to preventing pathogens from entering our skin and maintaining our skin health and so on. with regard to a reproductive tract microbiome, maintaining health and having a good balance of microbiome, particularly with regard to lactobacillus in the genitourinary tract, is very, very important. Our gut microbiome is probably one of the more complex, and we have the largest community within our gut, and it's quite a substantial amount compared to other niches of the body. But the reproductive tract and genital urinary tract is a lot more simplistic, I will say, because it seems to be dominated quite substantially by one particular species, which is referred to as lactobacillus, which is one of those probiotic, or I shouldn't have done that because it actually is real, probiotic or beneficial bacteria. So we get a lot from our bacteria and our microorganisms everywhere in our body and in our body, but they also get a substantial amount from us as well. They benefit from us because we feed them. We feed them orally, of course, when we feed them in our gut. So we give them quite a substantial amount of, if we eat fiber, we give them prebiotics, which are sugars and fibers, and they actually feed the good bacteria within our bowel. One maybe topical advantage to inhabiting a host such as a human for bacteria or other microorganisms is that humans are usually extremely social beings, and they get then our microorganisms then usually get to transfer from one individual to the other. Now, of course, I gave a talk, I remember last March, like not March just gone, March 2020, and it was the start of the pandemic, and actually they had asked me to talk about social microbes and microbes associated with allowing our social being to develop. And at that time I was, barely describing how we were, isolating and distancing a small bit and how our microbes were suffering. But at this stage, not that they're suffering, but there's a substantial shift in those microbes that do benefit from social interactions in the human population, because they're not getting transferred. And of course, we have the extreme amount of hygiene that we do need to prevent the transfer of COVID-19, of course, but all those other microbes that usually thrive on social interactions with humans are obviously not being transferred at the moment.
That is fascinating.
I love the social bit. Love the social bit.
Sociable. Wow. So in terms, and so there's a real change then, is there from, when we're younger right through our lives, there's a change in that microbiome?
Yeah, absolutely. So particularly with regard to, if we focus now, and my research does focus on the gut microbiome and particularly related to pain, so I can cover that in a moment as well. But if we think about it, and if we are getting benefit from our microbiome, it makes complete sense that it changes within our bowel during different life stages. So if we start off during pregnancy, we see the shifts in the gut microbiome, of course, vaginal and oral microbiome as well, but the gut microbiome of the pregnant woman is allowing the dampening of the immune response, it's allowing increased energy harvesting from the potential mom's food as well. Then, of course, the largest event of colonization, the baby is growing in utero and is fairly sterile. I was at a talk today where I was saying, yes, it's still sterile within the uterus because there's no definite research showing us otherwise. But there is research coming to the fore where there might be potential colonization of the baby in utero, but we're just not sure yet. But then the largest event of colonization, of course, is at birth, whether you're born vaginally or by C-section. But in the very early postnatal period that I alluded to earlier when I spoke about our preclinical model and interfering during the stress hyperresponsive period, that period in humans and also in rodents, it's shorter in rodents, of course, but in humans it's extremely important time. So it's up to about 5 years of age. It's extremely important period for laying down of your appropriate microbiome in the bowel. So during that stage, of course, of development, we have dynamic and huge changes in the baby's microbiome, but there is this largely dominant species, which is bifidobacteria and Bifidobacteria infantis and also lactobacillus. We now know from studies that these particular bacteria are very important with regard to development of the stress system, which we know impacts on pain system, but also development of the central nervous system as well. And then as we go through life, of course, then we have hormonal changes, and we know this interaction between hormones and the gut microbiome as well. During adolescence, then we see another very fluid scenario where there's big changes to the gut microbiome. And it's also not that surprising if we link our microbiome to brain health and disease and mental disorders. We know that changes that are induced during puberty may enhance or maybe allow the different disorders such as schizophrenia or depression to eventually emerge during that period. During adulthood, then, we see a very much stabilization of the gut microbiome, with healthy individuals having a very diverse microbiome, which is seen, which basically means where you have lots of different types or lots of different species of bacteria within the bowel. So the bacteria within the bowel are like us, usually, that they want to have their own communities and they want to exist together and they help each other and they feed each other. So as adults, we have healthy adults, we have a quite diverse microbiome where communities work together and exist together and thrive together. Then as we move into the elderly population, we see a decrease in diversity. And of course, things change. During our entire life, there's also going to be a number of factors that are going to impact on our microbiome. So in the elderly population, if there's a decrease in movement, of course, there's going to be a change to your gut microbiome. And change in diet, maybe if they're living in residential care or they're being provided meals on wheels or something like that, then of course their diet might change. And this could be inducing the change in the gut microbiome. But at all of those life stages, whilst we have the gut microbiome changing at these different life stages, we also have different factors that can impact on that, such as our diet, stress, medication, disease. But what we do know is that these changes at different life stages are actually helping us and helping us develop as individuals, helping us to develop the microbiome gut-brain axis, central nervous system, and also pain systems as well. So so there is very different changes during our different life stages as well that we need to be aware of as well.
And when we talk about the link to pain, are we talking about all kinds of pain?
Potentially. So some of the first studies looking at, and this is moving past this a little bit, some of the first studies looking at the gut microbiome and pain focus on visceral pain, particularly from the GI tract. So you mentioned irritable bowel syndrome there. So a lot of the first studies connecting gut microbiome to pain was particularly in the IBS population. It's moved a little bit outside the gut with regard to visceral pain, and it's linked now to maybe dyspepsia and some sort of pelvic pain in women as well, and endometriosis potentially as well. We're one of the first set of individuals, one of the first set of researchers to investigate the role of the gut microbiome, particularly in somatic pain. So we're looking at this in different contexts. We're looking at it in post-surgical pain. We're also looking at it in the context of gender differences with regard to pain. So most of the research on pain in either preclinical studies or clinical studies is on the visceral sensitivity, so the GI tract, moving a little bit outside now, but somatic pain studies are now starting to emerge with regard to the microbiome as well.
Okay. So we talk about we've talked about the gut-brain axis, and you talk about the microbiome gut-brain axis. So you're talking about the combination of all three, or I should say millions. How when we talk about the microbiome, we're talking what, millions, trillions?
Yeah, trillions, loads of bacteria in our gut. So I probably should have started off with the brain gut and explained how the microbiome is actually part and assists with the brain gut signaling. So there's three main, I suppose, signaling pathways within your brain, between the brain and the gut. And these include your stress system, which is your hypothalamic pituitary adrenal axis, your immune system, and also there's nervous connection, direct nervous connection as well via the vagus nerve, actually, between the brain and the gut. And then we know that there's events triggered in the central nervous system, such as psychological stress, for example, are perceived within the bowel. You may feel tense within the gut, you may feel butterflies, you might get, pain within the bowel, even temporarily if you're a little bit stressed. And then we know that events within the bowel, such as gastrointestinal infections, bloating, or a little bit of an upset tummy, do affect you psychologically. So we know there is communication between the two. And when I put the word microbiome into that axis, the microbiome is really assisting with the communication between these two end organs. And it does so because it can produce the exact same neurotransmitters that our central nervous system produces. It can produce GABA, which we know is involved in the central nervous system and anxiety, for example. The most amount of serotonin produced in the body is actually produced in the gut. 95% of our serotonin is produced in the gut. And we know that serotonin is hugely important with regard to pain. And also every other transmitter and neurotransmitter that's produced within the central nervous system is also produced by our microbiota. Now, they produce other substances as well, such as short-chain fatty acids, that can also impact on the central nervous system as well. With regard to how the microbiome actually interacts with our pain system and our central nervous system, it produces itself, as I said, a number of metabolites. These can actually, there are receptors for these particular microbiome produced metabolites on nociceptors. So actual receptors, sensory receptors for pain can actually respond and get triggered and activated by products of our microbiota. Then, of course, there's indirect interaction where our microbiome, an imbalance in our microbiome might lead to changes in the immune system. So toll-like receptors, for example, are very important with regard to inflammation, and we know that there's receptors for toll-like receptors in the sensory nerves as well. So again, and also even parts of your microbiota, so parts of the actual cell wall that can potentially leak into the systemic system, can actually activate nociceptors as well. So there's both direct and indirect communication, even peripherally, between our pain system and our microbiota. So it's not just, and the more research we're getting into with regards to how our microbiome interacts with our pain system and our nervous system, even peripherally and centrally, it's not a coincidence. There is a reason for this. Why would our nervous system have these receptors that can be activated by potentially elements of our bacterial community within our bowel? So it is there for a reason, to protect us a lot of the time, of course.
We have a question here. Bearing in mind our audience, we've got clinicians watching, sure, healthcare professionals and researchers. We also have a huge number of patients, of course, because we are the Vulval Pain Society.
Yes.
So there's a question here: what is somatic? What do we mean by somatic?
Sorry, I should have explained that as well. So when I mean somatic pain, so I mean anything outside the viscera. So if we think about our viscera are our GI tract, our heart, our respiratory system. Bladder pain, for example, is also, and prostatic pain as well, is also referred to as visceral pain. So any internalized pain really is referred to as visceral, and then anything outside of that is somatic pain. So I would term, and I think it's not my expertise, but I think vulval pain is a somatic type of pain. But of course, it's linked potentially, it might be linked potentially to genitourinary tract, and potentially to the bladder as well, and to IBS. So sometimes somatic pain can be comorbid with visceral pain as well, and they get intertwined with each other as well.
Yeah, absolutely. We've got some questions coming in, which I'm going to save. So Emily, I've seen your question. We're going to get to it. So, all right, and nociceptors, are kind of danger receptors. They kind of check for potential threat, potential danger in the body. We've got a whole load of different receptors in the body. Some are to do with touch, pressure, temperature. Nociceptors are to do with potential danger, potential threat, and they send up messages via the spinal cord up to the brain, and the brain decides what to do with that information, if it's received a message from the nociceptor, there's potential danger, the brain can then decide whether to amplify that and you experience pain. There's a few more complex things that go on. Yeah. I'm interested to know, how does the microbiome get involved in all of that?
Yeah. It is already a complex system. So we'll say, if you have in a perfect gut world, or perfect microbiome gut brain access world, you have a very nice tight linkage between the epithelial cells in the gut. So all our gut is this tube that decides what goes in and what goes out of it. So in situations where our body is stressed, for example, and I think there is a very close connection between stress and pain, of course, especially even acute and definitely chronic pain as well. There's a stress element associated with it. So they're often entangled with each other. So stress actually impacts on our gut and also on our gut microbiome. So what it does to our actual physiology of our gut is it can lead to increased permeability of this wall that is usually held very nicely together. The cells are usually held very nicely together with these tight junctions, is what they're called. It's quite a handy name as well. So usually your bowel wall is nice and impermeable, but in situations of stress or perhaps chronic pain as well, you can have a slightly more permeable gut. what that leads to then is it leads to changes. There's a bidirectional pathway, but as well between the actual physiological gut and the microbiome. So if one changes, the other will change, basically. So if your gut wall is more permeable, we're going to have a change in our gut microbiome as well. So the two of these are linked together. So what we tend to see is if we see a change in our gut permeability, we tend to see leakage of either whole bacteria can actually leak out through the bacterial wall. Parts of the bacteria can actually leak out of the gut wall as well, and this is referred to as lipopolysaccharide, and it leads to an enlarged immune response or enhanced immune response. And then antigens as well of bacteria may also potentially leak into the systemic blood system. So these bits that I'm talking about leaking through the gut wall leak into our blood system, which is peripherally and traveling everywhere in our body potentially. Then increases in inflammation, as we know, are linked very much to changes in our nervous system and changes in our pain response system. So this is one mechanism how stress, gut microbiome, and inflammation are linked with pain and potentially increase pain responses. So it's basically your bacteria leading to changes in the immune system is one particular pathway. But the bacteria themselves and the products as well, leaking out of the gut wall, can also travel directly to different body sites as well through the blood system to actually directly activate nociceptors anywhere potentially within the body. And again, there's still a lot of research going into this, but this is something that we're really, really interested in as well, is which particular metabolites or which particular bacteria are the ones that are key to this enhanced pain response. So we've done a number of studies looking at this now. We found correlations with particular bacteria. So one study we did was we're very interested in post-operative pain. And this was a study where women had gone through breast cancer surgery, which is also intensive course itself. But we noted that there was this persistent post-operative pain, which is 3 months after an operation or surgical procedure. And although my collaborators, George Shorten in Cork University Hospital, would have done extensive, workup of all of his patients pre-surgery in order to try and define and try and predict who was going to suffer from this post-surgical pain, because if you knew who was going to suffer from it, potentially you could intervene earlier with analgesics or something, is what he was proposing. So our particular study looked at we took a pre-operative sample of the feces. So this is how we do our analysis. We take a fecal sample from the patient. The patient would bring it on her surgical day. She'll present us with the sample, we freeze it, and then we can analyze it. So you can analyze the particular microbiomes and particular bacteria within a fecal sample of any individual. We use something where we know kind of part of the bacteria from a library. So we have a large library of different elements of different bacteria. So we're able to identify a huge amount of different types of bacteria. So what we did was we collected the fecal sample from these women, and then they went through their surgical procedure, and we assessed their pain, acute pain. So we assessed it 24 hours later, and we assessed it 3 months later as well. And we also gathered a number of different types of questionnaire data, looking at their stress profile as well, and also lots of different pain aspects as well. So what we noted that particular species that are associated with health, referred to as Ficalum prasnitzi, which is a bacteria, is nearly a probiotic species at this stage. Ficalobacterium prasnitzi has been decreased largely in this subset of women that had persistent post-operative pain at the 3 months after their surgery. So we saw a decrease in this particular beneficial bacteria. We also saw increases in certain species that are associated with inflammation, and associated Collinsella was one of those, and that was a study has shown that this particular bacteria is associated with rheumatoid arthritis, which is an inflammatory component. So we still have a decent amount of analysis to do. We have also looked at the functional profile of the bacteria from these women pre-surgically as well. And we found that some of the bacteria, with this really nice analysis, some of the bacteria that was present in these women pre-surgery even are associated with inflammation, but also associated with very well-known pain pathway profiles or cellular, intracellular signaling pain pathways as well. So we're still processing that data. We're very hopeful that maybe it will inform pre-surgical interventions in order to reduce the impact of this really debilitating disorder. I mean, you've gone through surgery and now you expect to be well, of course, and then 3 months after you're not well and you have something different going on. So these would be the types of studies that we would hope to go forward with and optimize or balance the bacteria in the pre-surgical setting in order to reduce this impact and reduce the risk of post-surgical pain.
Listening to that, I'm wondering then, going into the future, are we really looking at, this is individualized care, would we really be looking at perhaps fecal samples to see what's lacking here, what is that what we're going towards?
It could be. The only drawback is probably what is obvious, is that it's a fecal sample. But if we think, and to be honest, and it's amazing that people really, a lot of populations or cohorts of people we have signing up to our studies don't mind giving a fecal sample. There are cohorts or certain stages of life, particularly during pregnancy when constipation might be more prevalent, or of course in certain disease cohorts where constipation is more prevalent, such as the constipation dominant IBS, for example. But the majority of the time when people enroll into our studies, they don't mind giving a fecal sample. And I mean, we're well used to analysing them, and it's a very high throughput scenario in the lab. But if we think about it, and if we think about the beauty of probiotics and prebiotics and those food types, such as fermented food types as well, that actually we now know are very beneficial for our microbiome. We now know they're very beneficial for our health in general, including our mental health and every part of our nervous system. So if we think, and the beauty of these types of elements compared to a pharmacological intervention is that they have very little side effects. Some of the side effects maybe associated with them would be a little bit of rumbling tummy when you start on a new probiotic, for example, or prebiotic, a rumbling tummy, or perhaps a little bit of diarrhea or bloating for a few days, but usually things settle. So maybe going forward, instead of and it is expensive to analyze these fecal samples as well. So instead of increasing the healthcare costs, which we probably can't do in Ireland, we could potentially advise people in different settings, okay, prior to your surgery, for example, we advise you maybe a month or 3 months ahead to start consuming this intervention diet, or to change these elements of your diet, because you can very easily analyze somebody's diet using a food frequency questionnaire, which gives you information of somebody's diet for the last year. And while somebody might think and could potentially have a very healthy diet, they still might be lacking those particular foods that enhance the good bacteria and the bacteria that actually maintain a very healthy immune system and very healthy central nervous system as well. So you could potentially say, do the simple questionnaire, analyze it, and say, look, we actually recommend this diet, or else just recommend the diet pre-surgery to everybody anyway. That's the beauty of it, because it won't harm you and it doesn't have side effects. It only has positive effects.
Okay, so does a varied diet alone give enough of a variety of that gut bacteria? Or, because we're talking about developmental stages, so
Yeah.
And I've heard, I don't know how true this is, that if you were brought up in a family that was overly hygienic or a little bit too clean based, that perhaps that microbiome didn't have the ability to adapt and to proliferate. But then if things are always changing, does that really matter? Can that be adjusted later on with diet?
It can, and I know there's a lot of research on the hygiene hypothesis and whether it does reduce the, I suppose, colonization, the appropriate colonization of a baby's bowel, for example. And it is potentially there. And there was a very large study done in Australia looking at lots of different things, and even one of them was whether the mom sucked the dummy or not. It was down to that level, and what types of products were used in the house, and did you have a pet, did you have a sibling, what cleaning products were used. So I still think that the gold standard, of course, is to be vaginally born and to be breastfed. And I think even with just those two elements, without saying we have to have a very dirty or a very clean house, I think those two elements in very early life are key. And we know that in very early life, in the baby's bowel, it has a very low diversity. So there's very few different types of bacteria in the bowel. And those are coming either from the delivery, from, the vaginal delivery, or else, of course, from the breast milk. Of course, we do have the other scenarios where babies have to be born via C-section for medical interventions, and it saves lives, of course. And then, of course, some moms can't breastfeed for different scenarios, or the mom isn't even present, which is fine as well, of course. And then, of course, there's a lot of research done on infant formulas, and we now actually see a lot of infant formulas are doing research into not only prebiotics and probiotics in their formula, but also components of breast milk as well. Now, I believe, of course, infant formula can probably never capture and can't be as complex as human breast milk, but even incorporating those substances from breast milk and pre and probiotics can assist with a baby's bowel development, whatever the hygiene of the house was, of course. We do everything, of course, as a balance, but if we go back, and of course, in very early life, we can't have a very diverse diet for babies, of course, up until maybe they're about 6 months, we start adding some foods to their diet, and not to start off with a very diverse diet for the baby, because the baby probably won't even eat them. But we start off, very slowly with maybe pears and carrots, a little bit of those things, and then increase as we go on, because the first year of life is, as I said, a very low diverse bacterial situation or community within the bowel. But then after a year in a baby's life, upping the diversity of the foods is extremely important to give the baby the chance, of course, to have and feed these new bacterial communities that they're gaining either from crawling around on the floor, or from their siblings, or from pets, or from their mom, or from just going out in the world as well, of course. But if you don't have, we'll say, for example, the optimal gut microbiome in early life, there is a chance that your microbiome gut-brain axis will be programmed a little bit off kilter, because our microbiome is hugely key to programming the entire microbiome, the entire gut-brain axis in early life, because there's so many different pathways within it. Having that appropriate microbiome in early life is key to the programming of this axis and long life health. But regard to adding a diet in later life, of course, I do think, if there's no extreme risk of disease, no extreme disease after developing, that, needs to be intervened medically. And if it is, a situation where an individual hasn't very good gut health, has, stress, low level anxiety, maybe depression as well, consuming a psychobiotic diet, was what it's called, is those bacteria that are very good for your health and your brain, can definitely be beneficial, even if you don't have the good or optimal starting point.
That psychobiotic diet, you mentioned fermented foods. Are there other things we should be looking at? And what do you mean by fermented foods? So let's dive into that.
Yeah, no problem. When from an Irish background, we didn't really have fermented foods as I was growing up that much, or we didn't even know what they were. But fermented foods nowadays, and we know a lot of them come from Asian countries. So we have the kombucha, we have the kimchi, we also have sauerkraut as well, of course. So it's basically foods that are allowed to ferment with their probiotic species or yeasts within them. So, for example, one example could be kombucha. So kombucha is a fermented tea where basically you have this very strange thing called a SCOBY. And this SCOBY is basically a symbiotic community of bacteria and yeasts. And it looks kind of like a piece of chicken. It's can be white. It can turn a little bit brown depending on what tea or how old it is. But basically it's this community that exists. You pop it into some tea, basically, and you pop in some sugar to feed the yeast and to feed the bacteria within this community that is within your tea. You allow it to ferment, which is basically, fermentation is basically where the microorganisms are using up an energy source and producing their products then and releasing them into the tea, for example, in this situation. There are also a number of the species as well themselves, of course, go into the tea as well. So what you do when you consume your fermented kombucha, for example, you're consuming both the beneficial microorganisms, the yeast and the bacteria, for example, but you're also consuming their beneficial products, byproducts as well. And they're now referred to, these byproducts or these elements they produce are now called postbiotics. So it's basically the word postbiotic is used to describe anything your good bacteria actually produces. So those include, again, the metabolites such as short-chain fatty acids or some of the neurotransmitters they produce that we know impact on the central nervous system. So you don't just have to have a full diet of all these different types of fermented foods. We can also consume very normal foods as well, such as onions, garlic, bananas. So these types of foods are referred to as prebiotic foods. So they contain sugars and carbohydrates. Oats as well, of course, porridge, promoting porridge, is also extremely important with regard to promoting our good bacteria. So a diverse diet as much as you can, but also trying to feed the good bacteria with what are known prebiotic foods. Of course, I'm telling people just to, take our prebiotic foods, but it is also important as well, if you're putting food for your bacteria in there, to have the bacteria in there. And as we spoke about, maybe if someone doesn't have the optimal bacteria within their bowel, feeding it with prebiotics is good, but it's also very beneficial to consume probiotic containing substances such as your fermented foods, or else your yogurts as well, of course, or else we know there's a lot of fermented milk products on the market as well, which contain high amounts of these probiotic species.
There are a number of these yogurts on the market, and we're not kind of here promoting in particular, unless there's really good evidence that points towards any of these. Now, I know that I've had kefir in the past, or kefir, I think it's pronounced in the States, and the stuff in the shops doesn't tend to do much at all, but I've had some really potent stuff from a particular company, very friendly animals, shall we say. And I'd had it just after, and I'm mentioning this because I think I want to ask you about it because it's an important point. I started taking some after I'd had a course of antibiotics. Mm-hmm. I started on, they say, have 170 milliliters of this kefir, which I did, had a bit of a headache, but by day 3, the headache was much, much worse. And then I fainted. Now, I didn't know it was the kefir at that point. I couldn't know what happened. And then I phoned them up and said, is there any possibility it might be this? Thinking it probably is. And I said, oh, yeah, you've overdosed. You've been on antibiotics. You've completely depleted what was in your gut. And now your system's gone into shock. Is that a common experience? And would you suggest to people just be a little bit careful when you're adding in things like kefir or these kind of probiotics that might be a bit more potent?
Yes, absolutely. I hope that's not frequent, Sheren, and I wouldn't have heard many individuals actually fainting from it, but obviously it was the combined scenario of and it could have been potentially down to the scenario that you had to take the antibiotics for as well. It could be more complex than we think about. But yes, and even on some of the products, so my own children, I try to feed them well. But can be a challenge at times. But I always have them on this prebiotic supplement, because I think, okay, I'm giving them their yogurts as well. And my daughter would have had a little bit of bloating. She complained about tummy pain. And I said, look, okay, I know about healthy foods. Here's the healthy foods. And it still wouldn't go away. And perhaps, again, perhaps it was down to stress. I don't know. But because it was a stage of life where they don't really tell you if they're stressed, or, you ask them about their interactions during the daytime, nothing really comes out. So no, the point is that I have them always on this prebiotic supplement. And even if, and it says on the box, basically, it's a powder supplement, and it says in the box, if you're fresh to taking this or you're new to taking this, only take half a sachet or less a day at the start. Do not start with half a sachet, or do not start with a full sachet. And that's even for adults. And even there are occasions where we run out of the supplement, for example. And I have started the children straight back on a full, and there would be a week break, for example, in them taking the prebiotic and just starting the fresh batch. And I would just start them straight off on a full sachet each. And they have both had GI upset if I start them straight away again on it. So even a week's break or a week of having nothing is enough to lead to even an upset tummy. So I would definitely say take a lot of these supplements, because there are now maybe very strong supplements on the market as well, which can have a huge impact, because we now know they do impact not only on your bowel, but also on your systemic system and your central nervous system. So caution does need to be taken if you're starting a new supplement. With the diet, and I would look at the amount of probiotic species within them as well. If it's over 10.9, that's very potent, which is great that you have to take less of it, but really slowly introduce it. And then don't be impatient as well. Like, don't give it up after a week if you feel no bad effects or good effects. Like, you should continue really for at least 3 months on any new probiotic or prebiotic supplementation. Diet is a little bit different. I wouldn't change it overnight as well, and it's probably impossible to maintain something you change overnight with regard to diet, but it shouldn't be as potent if we change our diet. If it's the likes of, unfermented foods such as our garlic and our onions and so on. But you know yourself, if you introduce them straight away, or if you eat too much garlic, you do have an upset belly for a little while. So I would introduce everything quite slowly at the start, but then don't lose patience. That 3 months should be at least the minimum of when you use these supplements or dietary interventions. Gosh, Sheren, that's tough.
Right. Although they weren't surprised, so that's just something to mention. They weren't surprised, and they straight away said that that's what's happened. You've overdosed. So I think it's just important for people to know. Start off slowly, and you were saying the number is, if there's number of probiotic species over 10.9, then just start slow.
10.9, exactly.
A question from my fellow trustee, Dr. Winston de Mello, who I know is watching on YouTube tonight. He was telling me about an unpublished undergraduate project a few years back, which revealed 3 probiotic candidates, shall we say, as being particularly effective in treating those experiencing post-antibiotic UTIs.
Okay.
So I'm going to mention the 3 and see whether you've heard of them, and tell me if there's something better, what you know about these, or there's, whether these are still kind of particularly useful. And the 3 he mentioned were Biocult Pro Cyan, Optibac for Women, and Simprove. We're some years on now, so I'm just wondering, have you heard of these? What are your thoughts?
Yeah, I've heard of the first 2. I haven't heard of the last one. I know the one with cyan in it. It's Biocult Cyan, that has cranberry in it as well, I think. So it's probably the combined effect of the cranberry, which we know is very beneficial for UTIs, of course. And I have looked at, and it was for an individual who's related to me, that I did buy this product because I looked at the back of it and to see which probiotic species were in it. I can't remember them off the top of my head now because it's not a supplement to take myself, but I know they had, and Biocult typically have more than 1 probiotic species within it. But the species that were within it at the time, if I recall, are beneficial, particularly for the genitourinary tract, because we have our own microbiome within there as well. So there is science behind, I think, the Biocult probiotic, because I could define some of the bacteria species that were in there. Not all, I didn't know them all, but I knew that there was definitely some, maybe 2 or 3 that have been shown to be associated with a healthy genitourinary tract. And then with the combined effect of the cranberry as well, maybe there was a dampening of the immune response as well. The Optibac, I've heard of it, but I can't recall seeing the probiotics on the back, because it wouldn't be in a product that I actually investigated. And then the other one, I don't know.
Okay, so the Optibac for Women is the one that Dr. Winston de Mello mentioned, and Simprove is one that I have first-hand experience of, which personally for me, certainly for things like IBS and repopulating the gut bacteria, has made a difference in all sorts of ways. So, the microbiome seems to be important in so many areas here of health, and it seems that it could potentially play a role in other long-term issues as well, long-term health issues as well. And you know, I wonder, diet, supplementation, and then we've got a question here about, how about fecal transplants? What are your thoughts?
Great question. Be very careful. No. So fecal microbial transplantation has started out saving lives. So it saved lives, those lives of individuals who were suffering from antibiotic-resistant Clostridium difficile. And it completely, these people wouldn't have lived without the microbial transplantation from a donor. And since those studies, or since those interventions, FMT has been proposed to be used for lots of different scenarios. And I do believe that we are doing studies ourselves in the lab looking at child temperament and fecal microbial transplantation. So I do think it is it's a very interesting tool. We do need to be extremely cautious for the donors. So I think nowadays we probably have a halt on donors at the moment because of the pandemic, but it is something that I think can be very easily achieved, because trying to change someone's gut microbiome with regard to, if we think about obesity, for example, there's a very specific profile of microbiome within the obese gut. And trying to change the microbiome to a lean microbiome in the bowel takes a very long time to convince it. And also we have obviously interaction between our microbiome and the genetics of our body as well. So if in extreme situations, such as C. diff, for example, or very imbalanced bowel bacterial situation that is really impeding on someone's health, then a fecal microbial transplantation could be the best possible option. We do need, and I remember this started a good few years ago. I gave a talk in London on FMT, and at the time we were just starting to bring out the concept that your microbiome can actually affect your central nervous system and your well-being. So I was making a joke saying, we actually, if we're going to profile our donors a bit better, we really do need to take their psychological profile into account, because you really don't want to transfer, sadness or depression. And they were kind of laughing, but in actual fact now you really do. So I do believe it is something that can be extremely useful going forward for severe bowel microbiotic disruptions. It is intensive, and it's, it takes a while for it to adjust. Of course, it mightn't take in certain individuals, and you have to have repeated colonization and just very careful donor selection, of course. But there are these super donors. I'd love to be a super donor around the world now that to say it, that have been, extremely well profiled, and then their microbiome, is constantly being transferred to other individuals, of course. But there was something on YouTube a while ago, this a few years ago at this stage, I was giving a talk I give talks to secondary schools and primary schools as well. So it was a girls' school. And God, they were so innovative, this set of girls. So I was trying to make things funny, because I'm not that funny. But I was saying, you need, this is, I was trying to shock them with the FMT first of all. And then I said, but you need to be extremely careful, because this mom in the States, basically, you can YouTube how to do an FMT yourself at home. So this mom, I think she had GI disruption. She had a very upset bowel. So she basically, had a daughter, and she said, okay, her bowel frequency is very healthy. She's no bloating and this and that. So she said, let's do an FMT. You're related to me. You seem okay. Let's do it. So she did it, and she transferred her daughter's fecal situation, fecal microbial community, to herself. And she did it in a very appropriate manner, as was indicated by YouTube. But she noticed after a time she started to gain weight. And when she, when it all came out, her daughter's BMI was actually, more than the healthy BMI, shall we say, for example. But so she transferred a healthy, non-bloated, non-painful gut, but she also transferred the obese phenotype as well. So we do need to be very, very cautious about where our donation is coming from.
Not sure about doing it yourself. I don't think being informed by YouTube and doing it yourself is the way forward. Maria Elliott, one of our fabulous physios, who's a previous guest, has said FMT has helped ulcerative colitis. So yeah, definitely being used for good. There was a question about, let's have a look. Actually, yeah, there was, I know I saw one about what are the ideal species in particular that would benefit the vulva?
So I think the species that would benefit the vulva would be those that reduce inflammation. So we know that certain lactic acid producing bacteria are very prevalent around this area of the body anyway, particularly lactobacillus. So lactobacillus is a really clever bug in our body in general. We know it's extremely prevalent around the genitourinary area as well. It's very important with regard to making the optimal pH. So it lives off glycogen, basically. It lives off glycogen anywhere within our body, but particularly within the genitourinary area as well, and in the vulva too. So it produces lactic acid, which optimizes the pH, and also it has antimicrobial or anti-inflammatory properties as well. So trying to maintain a balance in at least lactic acid producing bacteria, but also particularly lactobacillus probiotic species in the vulval area, I think would be key. And that can be achieved. It doesn't have to be, achieved through a topical application, but it can be achieved through changing your diet. Not necessarily having to take a supplement, but changing your diet to those prebiotic species, because there is a relationship between our diet and our skin microbiome and, different niches on our body. It doesn't just have to be diet is going to change our gut only. If we change our diet, it increases well-being of our whole body. And it also allows those species that might be there but less dominant to actually become more dominant then, because you've changed the health status of the entire body and potentially of the vulva as well, allowing those lactobacillus species to actually thrive and to do their job, reduce inflammation, reduce pain as well, because they have an anti-inflammatory, but they also have an anti-nociceptive effect as well, which we have shown in some of our studies as well.
Okay, brilliant. Now, I'm mindful of the time, so I'm just going to quickly grab this question here. Can we measure lactobacillus optimal levels in the vagina via a swab?
Yes, absolutely. It's super handy. So it's literally, you take a swab in the vaginal area, literally like something like a Q-tip or a COVID-19 testing swab. So something like that. And then you pop it into the container and literally we just analyze it in the lab as we would for fecal microbiota profile. It's a lot of the same species exist within the vagina as well as they do within the gut, but it's very easily measured and is measured quite frequently as well. And we're carrying out a study looking at vaginal microbiome, oral microbiome, and the gut microbiome, as well as some of the endometrium in an endometriosis study that we have as well. So it's quite easily measured, and it's very important to measure it as well. And it could be something that could be done on a regular basis to actually check, what your microbiota profile is with regard to your vulva and your vagina, to check if you do need to actually modify your diet or introduce a supplement of some sort to rebalance everything.
Oh, there's a question here. Now, I'm really mindful we might go a few minutes over. Is that okay? Because
yes, no problem.
SIBO, and I've noticed it's popped up here. Would it make sense to consult a pain consultant re the possibility of pain in the gut caused by SIBO or gastroparesis? Would it be
sorry, Sheren, say that?
Would it make sense to consult a pain consultant regarding the possibility of pain in the gut caused by SIBO, S-I-B-O? It says SIBO Amanda, gastroparesis.
Now I understand, sorry. Small intestinal bowel overgrowth. So it's an imbalance in your bacteria particularly. So I would hope that in the future, maybe pain consultants would become more familiar with the gut microbiome. I work with fantastic people in Cork University Hospital, so I can talk firsthand about my own experiences with pain consultants, and they're becoming very mindful of the gut microbiome and with regard to maybe small intestinal bacterial overgrowth and gastroparesis and so on. But I don't know if they're in the minority just yet, particularly when it's not, localized to the particular region. I think the concept, as I mentioned, of your gut microbiome or your microbiome in general and somatic pain, so pain outside the gut really, is really only, it's not in its infancy. We could say maybe it's in its toddler stage a little bit. So I think maybe a lot of pain consultants mightn't be on the page yet, but hopefully more and more are coming to the concept that your microbiome is extremely important with regards to pain management. But it is difficult when we know, and again, this is why it's important to have multidisciplinary, influences as well with regard to management and pain management. If we talk about the microbiome as being extremely important, but I do know there's a lot of consultants now really appreciating, that diet is important, that supplements are really, really important, and I know certain consultants would recommend certain probiotic species to improve health. But from the pain side, I'm not 100% sure globally how much it's appreciated just yet, but hopefully it will be.
It's an emerging area, isn't it?
Yeah. Really, yes, absolutely.
And someone's asked, is a GP likely to be able to do the vaginal swab? And I imagine, look, probably not is the answer at the moment. It's unlikely.
Your microbiome?
Yes. Yeah.
No. No. So I think probably the vaginal microbiome might be analysed in a situation of bacterial vaginosis or something like that. But for, a regular swab where you kind of want to see if there's an imbalance, currently it's definitely not done in Ireland, where your GP will take a swab and send it off to our labs, for example. But I mean, wouldn't it be fantastic if that was available, or if there was a home testing kit where you could test yourself? And I think there are two, and I don't really want to mention the names of these companies because I'm hoping to do something like this myself. But because wouldn't it be fabulous to have like home testing kits where we can, test something really easily and simply without having to make an appointment or go somewhere. You just send off you do your swab at home yourself, which is super simple. You send it off without even having to go to your GP, send it off to somebody, you get your results back and have potentially a consultation online advising how you can actually improve either your vaginal health or your vulval health. I think that would be really key going forward. I'd love it.
And is we're kind of looking into the future, and these are kind of things that hopefully are coming in the future with people, good people like you doing the work. I guess at the moment we're looking at varied diet and supplementation.
Yeah,
go on.
Oh, sorry. I want to say exercise is extremely important.
Exercise.
Exercise.
Any final points, because we're a couple of minutes over the 1 hour mark, and I'm going to tell people about who's coming up next as well. What would be a point to, I suppose, wrap things up with, a take-home point?
Yeah, I would just say that, of course, it's easy to say don't focus on pain, but focusing on pain is, can often make it worse. So taking control and having power to control your pain, and there is potentially power to control your pain through a very easy mechanism, through your diet, through exercise, and through well-being as well. We can throw some meditation and some like relaxing breathing in there as well, but I often think taking control of your own health can actually be key to actually resolving situations like pain, for example. So as I mentioned, varied diet containing, and anybody can Google the different types of prebiotic foods. But prebiotic foods, as I mentioned, such as our bananas, our onions, our garlic. But again, you have to select these if they're too maybe potent for your gut, which garlic can be for some people. So maybe choose different species like artichokes or blueberries and things like that. Reducing red meat, of course, is always key to a healthy diet. I'm not telling anybody to be vegan or anybody to be vegetarian. We need our protein in whatever way you decide to take it, but a varied diet of prebiotics. And then if you need probiotic supplementation, if you're still not feeling the benefits, you know, a few months on of changing your diet, a probiotic supplement on the market where you see several probiotic species within it, monoprobiotic species or monoprobiotic supplementation, and there are a few on the market as well, but I would suggest products containing several different species. And for vulvar pain or for vaginal health, one that contains lactobacillus is key to maintaining that type of health. So yeah.
Fantastic, brilliant. Seriously, absolutely blown away. I had no idea we'd gone, you know, over time, and we've got loads of questions still to come. So I think, you know, at some point we may have to have you back on when perhaps you've got that testing kit ready for us. Thank you so much. Thank you so much.
Thank you.
So before I tell everyone, Kay Thomas from my colleague at the Vulval Pain Society is saying, we need another hour. Absolutely.
I know, I love it. This is gorgeous.
So a reminder then that not only can you watch this wonderfully informative live stream again, but all our live streams and a selection of webinars, you'll find them on the Vulval Pain Society Facebook page and the VPS YouTube channel too. Follow us in either of those locations or both of those places, and you'll be notified of upcoming events. We're also on Twitter, and we're sort of getting started on Instagram. But anyone want to give us a hand on that? Let us know. You can email us on info@vulvalpainsociety.org.uk. So do connect with us, share our posts or our tweets so that more people can get access to evidence-based information. The next time, 7 p.m, Tuesday, the 8th of June, we have our very own Dr. David Nuns, founder of the Vulval Pain Society, consultant, gynecological surgeon, and clinical lead of vulval health multidisciplinary team at Nottingham University Hospitals NHS Trust. He specialises in gynecology, of course, and also oncology and vulval disease. The topic next time is vulval cancer. David will cover symptoms, people at risk, what to look for, self-examination, investigations, and management. So that's next time, 7 p.m, Tuesday, the 8th of June, with Dr. David Nuns. That's all from the Vulval Pain Society for now. Thank you again, Dr. Siobhain O Mahony.
My pleasure, so really my pleasure. Not at all.
And
really fantastic.
It was brilliant. Thank you. And thank you everyone for watching, joining us live or on the replay. Bye for now and see you next time. Cheerio.